Pneumonia is a serious respiratory disease characterized by inflammation of the air sacs, alveoli, in one or both lungs. These tiny air sacs normally fill with air during breathing, allowing oxygen to enter the bloodstream. However, in pneumonia, they become inflamed and filled with fluid or pus, making breathing difficult and reducing the body's oxygen supply. Pneumonia can affect people of all ages, but it is especially dangerous for infants, young children, elderly individuals, and those with weakened immune systems. Causes: pneumonia can be caused by a wide range of infectious organisms. The most common cause is bacteria, especially Streptococcus pneumoniae. Other bacterial causes include Mycoplasma pneumoniae, Haemophilus influenza, and Legionella pneumophila. Viral pneumonia is also common and may result from viruses such as influenza, respiratory syncytial virus, RSV, or coronaviruses. Fungal pneumonia, though less common, can occur in people with compromised immunity and is caused by fungi like Pneumocystis jirovecii or Histoplasma species. In some cases, pneumonia can develop after inhaling food, drink, vomit, or chemicals into the lungs, a condition known as aspiration pneumonia. This often occurs in people who have swallowing problems or reduced consciousness due to illness, alcohol use, or medication. Types of pneumonia. Pneumonia is often classified based on where it was acquired and what organism caused it. Community-acquired pneumonia, CAP, occurs outside of hospital settings and is the most common type. Hospital-acquired pneumonia, HAP, develops during hospital stays, especially among patients in intensive care units. A more severe form, ventilator-associated pneumonia, VAP, affects patients using mechanical breathing machines. There is also atypical pneumonia, usually caused by organisms like Mycoplasma, which produces milder but lingering symptoms. Symptoms. Symptoms of pneumonia can vary depending on its cause, the patient's age, and overall health. Common symptoms include high fever, chills, and a cough that may produce green, yellow, or blood-tinged mucus. Many people experience chest pain, especially when breathing deeply or coughing. Shortness of breath, rapid breathing, fatigue, and weakness are common due to reduced oxygen levels in the body. Other symptoms include sweating, headache, nausea, vomiting, and loss of appetite. In older adults, pneumonia symptoms can be subtle and may appear as confusion, low body temperature, or unusual tiredness rather than typical respiratory complaints. In infants, the signs may include restlessness, difficulty feeding, or fast breathing. Risk factors. A number of factors increase the likelihood of developing pneumonia. These include being very young or very old, having chronic illnesses such as asthma, diabetes, or heart disease, or having a weakened immune system due to HIV, cancer treatment, or long-term steroid use. Smoking damages the lungs and significantly raises the risk. Living or working in crowded environments, poor nutrition, and exposure to air pollution also contribute to increased vulnerability. Complications. If not treated promptly, pneumonia can lead to several serious complications. One of the most dangerous is respiratory failure, where the lungs cannot provide enough oxygen. Another is sepsis, a life-threatening condition where infection spreads through the bloodstream. Fluid can accumulate around the lungs, known as pleural effusion, and may require draining. In rare cases, pneumonia can cause lung abscesses, which are pockets of pus inside lung tissue. Diagnosis. Doctors diagnose pneumonia through a combination of symptoms, physical examinations, and tests. During a checkup, a doctor may hear crackling or bubbling sounds in the lungs. A chest X-ray is the most common diagnostic tool, showing areas of inflammation or fluid. Blood tests help identify infections, while sputum tests analyze mucus to determine the exact cause. In severe cases, CT scans or blood oxygen measurements may be used. Treatment. Treatment depends on the type and severity of pneumonia. Bacterial pneumonia is usually treated with antibiotics. it is important for patients to complete the full course even if they feel better early. Viral pneumonia often improves on its own, though antiviral medications may be prescribed in some cases. Treatment also includes rest, drinking plenty of fluids, fever control, and oxygen therapy for people with breathing difficulty. Prevention. Preventing pneumonia is possible through several measures. Vaccines such as the pneumococcal vaccine protect against common bacterial causes, while the flu vaccine reduces the risk of viral pneumonia. Good hygiene practices like frequent hand washing and covering coughs help prevent infections. Quitting smoking greatly lowers the risk and improves lung health. Maintaining a strong immune system through proper nutrition, exercise, and adequate sleep also plays a crucial role.